Hi, I'm State Senator Bob Mensch, and welcome to this edition of the Mensch Report. And this is the second of two shows that we are doing highlighting services, community services that are available in the Pottstown region. I hope you enjoy today's show. Please join me. I'm joined now by Dave Craybill, who is the president of the Pottstown Area Health and Wellness Foundation. Dave, good afternoon. Thank you for joining us today. Tell us a little bit about what is the Pottstown Area Health and Wellness Foundation, and it has a very intriguing, interesting genesis. So if you could talk about the beginning of the organization.
Well, in many respects, there's been a national phenomena where community hospitals have been sold to for-profit entities. And what this means in the end is that a foundation has been formed from the proceeds of the sale, which is used in this case for health and wellness purposes. And you still have the hospital there really treating and detecting disease. So it was a win-win for this community when that occurred. And in many respects, that corpus, which was formed, allows us to give out about $3 million a year. I think many people know what United Way is. It's more like the checking account for the community. And so it's important to have a strong United Way in the region. But also, at the same time, the foundation is more like the savings account for the community, or more like the 401k for the community, where we're able to invest those funds and then use that interest income to put back in the form of grants to help the community in many different ways.
Can you tell us a little bit about some of those different ways that you help the community?
Well, certainly I can. I think in many respects the area that we serve is about 230,000 people in 3
Let's talk
counties.
about the footprint first.
That's the footprint.
Yeah.
And it's a 10-mile radius. It's 230,000 people. In some respects, people may think of this region as simply being Pottstown and 22,000 people, but over the past really 20 years, there's been incredible growth. And what once might have been a community in that region, maybe being 120, 150,000, soon grew to 200,000 people in a span of 10 to 15 years. I think we're going to continue to see that growth happen. So we have an area, perhaps of some economic and social need in the form of Pottstown, but the foundation serves with that $3 million a year in grants, both the immediate vicinity of Pottstown, but also the school districts and community within that 10-mile radius.
And you said it's 3 counties. Of course, that would be Chester, Berks, and Montgomery counties.
Exactly. I'm glad I certainly have that memorized. And we have served 7 public school districts and as many private schools in that region with our grant making for healthy behaviors, part of what we do.
So what exactly are healthy behaviors?
Well, in many respects, what people don't realize is that about 80% of disease is preventable over a lifetime. And even in our mature age, 65% of disease is preventable. And so we have been looking really to byline of people leading healthy lifestyles that can last a lifetime. And that's what we're really trying to do. And by how we do that is really encouraging young people, because when people reach my age, it's a little more difficult to perhaps change your behaviors. But if we can encourage children and families to adopt healthy behaviors, they might last a lifetime. And what we know is that if you look at certain diseases, whether it's diabetes or heart disease, 90% of that is preventable. So here's a great opportunity for us, perhaps to become one of the healthiest parts of Pennsylvania by starting with our children and families at a young age.
You know, 2 years ago in the Senate, I was chairman of Aging and Youth Committee, and it got me involved with the Alzheimer's task force that we did under Governor Corbett. And we visited 9 different locations of the state and studied, met with the folks, studied their demographics. And what we found were there was great commonality in the issue of Alzheimer and memory-related diseases. And as we peel this onion back further and talk more with researchers, we also found that there was a huge health link to what you eat, and that Alzheimer's and other memory diseases very likely are connected to early eating habits and early health habits. We have found, for instance, that obesity and bad dental care actually contribute to the disease and to the earlier onset of Alzheimer's. Possibly we can't affect a complete onset, but people are becoming affected much earlier in life, and we're finding that there is this health connection to even Alzheimer's. So I think there's probably a lot of connection from diet and exercise right through to all of our health in every aspect.
In many respects, our board and our staff have taken a long-term view to dealing with that. And so what we're trying to do is encourage those healthy habits early in life. We have active learning in schools, which means that children are active during the school day, whether walking to school or being active in the classroom day itself, which can lead to better educational outcomes. It can lead to better health outcomes. It can even lead to better social outcomes, like some of the energy you might come into the classroom with is dissipated by education, or by activity, excuse me. I also feel that we've been looking at supporting and growing our parks network so people can be active and outside. And we also are working with making sure people actually have access to health care through our FQHC, which is Community Health and Dental Care. And FQHC is a federally qualified health clinic. So many different ways we're trying to prepare the children of today to have better health tomorrow.
Dr. Jeff Sparagano, who's the retiring superintendent here in Pottstown School District, the first time we ever met, he began to talk to me about the walk to school program that he was instituting, and he wanted to encourage more young people to walk to school, and that the exercise made them mentally much fresher and much more prepared to be able to engage in learning for a full day. So even academics can be affected with greater exercise and greater health.
I would also say that certainly we're looking at the academic community because there's a large number of students we can reach and their families at one time. But as our chamber president, Eileen Dotrig, noted, those same individuals are going to be into the workforce. And so we're also working on things like worksite wellness, where individuals can be active during the workday. So some of those same ideas that help our young people in school have better academic outcomes also end up being in the workforce. So we have this relationship between good health and education, which then can become good health in the job force, which also then becomes really economic development.
So within this 10-mile radius footprint in the 3 counties, how does one organization, how does the organization learn about you and begin to approach you to see whether or not they qualify for a grant?
Well, certainly they can go to our website, which you'll see across the bottom of the screen here, and look there and see how they can perhaps apply for a grant. We would encourage them to have a conversation with one of our program officers ahead of time, just to explain what the possibilities might be and see how it would fit with our mission. And then they would actually fill out a grant application, a letter of intent in this case, basically 2 pages describing what they would like to do, and we review it once, and then if we feel that it merits going on a little further, we'll invite them to come back for a full grant application. The whole process takes roughly 4 months, so between August and the applications and by the time our board approves it in November, it's roughly a 4-month process. So we look forward to the conversation. We are a place-based foundation. We like being able to relate to our grantees and our community face to face, and so we encourage that conversation ahead of time. Again, we're your foundation next door. Your foundation is at really high in Hanover, which really is the center of the whole region.
And while you were giving that answer, I was thinking too that what you do is not redundant to what the government does. It's really unique and separate from some of the grant programs that we would have at the government level. And then when you said you process it in 4 months, I knew that you weren't doing it the same way the government does.
Well, I appreciate your sense of humor, Bob, but I'll also say the government is a good partner. And what we seek to do in many of our situations and many of our collaborations is work with the nonprofit community, work with the for-profit community, work with government to affect change. A good example of that has been our program with DCNR and the what we would call recreation coordinator position, or circuit rider position. That's a program where the state had an opportunity for us to have both some capital dollars for parks improvement, but also someone who would coordinate in the area. And so that one person would sit down, in this case works with the borough of Pottstown and 5 surrounding townships, and is able to coordinate both trying to receive additional dollars and also parks programming within what we would call the greater Pottstown area. So a neat collaboration yielded even more collaboration at the local level.
And of course, a lot of that collaboration, as you were talking, I'm thinking the carousel, the train, the park over here in Pottstown Memorial Park, yeah, and some of the services that are contiguous to each other and yet are able to provide the exercise, the outdoor enjoyment that you're so keen to provide?
Well, I think in many respects we're trying to support collaboratives that work with the region in many ways. And so whether it's the Tri-County Network, whether it's the West Campus of Montgomery County Community College, whether it's our chamber, whether it is the Pottstown PTIC, the Pottstown Trauma Informed Community Connection. There are multiple layers here that collaborate and work together, and I really think this region is developing a reputation, whether it's the county level or the state level or beyond, of the ability to have conversations together, to work together, to reach a common good.
What are some of those partners? You mentioned a few.
Sure.
Can you dig into a little bit deeper detail on each?
Well, certainly, I think you're familiar with the Chamber of Commerce. Again,
Of course.
similar area that's here. We have a Tri-County Health Council, which is the hospital, this foundation, Creative Health, and also Community Health and Dental Care working together.
Trying to take a step forward, but everyone's aware of the process.
We're trying not to repeat services. We're trying to create a continuum of care. In this case, for patients in the Pottstown area. We also have certainly Tri-County Network, which is a collaboration of nonprofits. We have Park, which is a collaboration of recreation entities, basically governmental entities working together.
Now, who controls that? One effort. I mean, who's at the top? Is it the Pottstown?
Well, in many respects, I think it's a group of people coming together. So I don't know if there is a top per se, but it really is, in this case, 5 townships in the borough coming together with a recreation coordinator, working together to perhaps have some joint grant applications, perhaps have a joint vision for recreation in the region, perhaps have some joint program, even some joint advertising that will go out to draw people here. So it truly is. There may be catalysts in the form of the recreation coordinator at the center of that, but it really is a group of people making things happen. I think more recently we mentioned the Pottstown Trauma Informed Community Connection. That's really building on ACEs, which are adverse childhood experiences, which can really predict long-term what health behaviors might happen. You're talking about health behaviors in earliest ages. If you have trauma in those earliest ages, it might be family dislocation, it might be drug abuse, opioid use, when you think of today, it could be divorce, et cetera. That can be a predictor of long-term outcomes. And so what we're really working here together is, again, as a community, to work together to identify that and how that then flows through our community. So multiple layers, multiple collaborations, making the region stronger together.
Thank you very much, Dave. It's a pleasure to be here with you today. And I was taken by your partnerships, purpose, people, progress, and pride.
Well, that's Pottstown, and that's the region.
Yep, that's the region. So thank you very much. Enjoy the rest of your day.
Thanks, Bob.
Viewers, thank you for joining us here at the Foundation, and we look forward to continuing our tour this afternoon with Creative Health. I'm joined now by Andy Trinacoste, who is the CEO of Creative Health Services here in Pottstown. And we just left Dave Crable, and we were talking with the Foundation and their interrelationship with the various services and the funding that exist. And he talked a great deal about the community effort. And he pointed to your organization more than once as being a very critical partner to what is going on in the mental health and probably drug abuse areas here in Pottstown. So please tell us a little bit about yourself. How did you get started in this? And then tell us about Creative Health Partners. And I know that we have some visuals here.
Well, one of the reasons we work well with the Foundation is that our service area very roughly mirrors theirs. We serve about 10 miles surrounding the borough of Pottstown, which is this map here. So we go into Chester, Montgomery, and Berks counties. We've been in existence for about 60 years, created right here in Pottstown, originally to serve the needs of returning vets, people that are coming back with what at the time we called shell shock, that we now think of as post-traumatic stress disorder. So that really, that history of trauma and serving our community is how we were founded. Over time, as funding and regulatory mechanisms changed, and more importantly, the understanding of behavioral health or mental health, the importance of it grew, we've grown and changed into what we call a community behavioral health center. So behavioral health is the core of what we do. Mental illness is part of that, addictions are part of that, but also helping our young kids grow in their class, helping teachers, consulting with teachers to help with kids with problem behaviors in all different ways. The core of it is healthcare for people with mental health problems, but it expands beyond that into prevention and consulting with a lot of organizations in our community.
Very good, very good. Now I know we talked earlier, I'd like you to expand a little bit on PTICC, which I understand is a new venture.
Yes, PTIC stands for the Pottstown Trauma Informed Community Collaborative. It's a really exciting opportunity for several organizations led by the school district and PEAK, the Pottstown Early Action for Kindergarten program, to help our entire community understand the importance in all of our lives of trauma, or what is now being called adverse childhood experiences. A lot of times when we talk about trauma, we think about, oh, that's something that happens to somebody else. So what are adverse childhood experiences? Adverse childhood experiences were studied, 10 phenomena that are very common in children's life were studied. They revolve around things like divorce, domestic violence, or mental illness and drug and alcohol problems in the home, but more ordinary experiences, unfortunately, that our kids are faced with. These adverse childhood experiences, and you can look it up on our website, pottstownmatters.org, have tremendous impact across the lifespan on a person's economic development, their physical health development, their social development, and their behavioral development. So they're critical for us to address early in life and to understand early in life. One of the things that we're learning about kids, for example, is kids are not quote-unquote behavior problems. Kids use behavior to describe their everyday experiences. And those kids who are having trouble, for example, in schools, staying on grade and staying in class or sitting still, might be trying to explain to us that they've had some difficult experiences in their life. They're taking up so much of their mental energy that they're having trouble sitting in their classroom. So it's helping us reframe the nature of the problem for our community. So it's a very exciting time.
Very good. Very good. Now I know that you want to take us on a tour of the facility, and we have some staff that we're going to have a chance to meet and help us with the tour. So lead on.
Going this way. We're going to go through our waiting room.
Okay.
So we're standing in the waiting room for our main location in 11 Robinson Street in Pottstown. We have 7 other locations that serve a lot of the same functions as this one, but this is by far our largest. So here, any of our community residents would come in to check in to get a variety of their services met. We have mental health outpatient counseling programs, we have drug and alcohol counseling programs, we have case management services, and a variety of other things that operate out of this building. One of the unique things about Creative Health as a behavioral health center, we also have an on-site pharmacy here so anyone in the community can come here to get their medication needs met. It makes it really convenient for our customers.
Right, very good.
So we'll head down this way and I'll show you a little bit of the building.
Okay.
So as we walk through, most of the offices you'll see are counseling offices. People will come here to discuss their problems, meet with a psychiatrist or a mental health professional to discuss and plan for their treatment. We're going to head down this way through our consumer gallery into our intensive recovery support programs.
How large staff do you have?
We have about 300 full-time equivalent staff members.
In all 8 locations?
In all 8 locations, a mix of direct employees and independent contractors.
Okay.
So as we walk through, you'll see a couple gallery walls. Most of our artwork is either produced by our consumers or local artists in the Pottstown region, which we purchased in galleries. And as and this way, you'll see better examples of that. We had we in consultation with Art Fusion here in Pottstown.
Sure,
we had
down on High Street.
An anxiety program where they had some vets come in and talk about anxiety, and they did a whole art series around anxiety and the impact of it. And we called it The Anxiety Show.
Mm-hmm. All 3 of these by the same artist?
Yes.
Okay.
As we wind around here, we're into some of our adult services. The services that take place in this part of the building are for folks with serious and persistent mental illness. Primarily schizophrenia, bipolar disorder, and things like that. Now, just to put it in sort of the context of our community, that's about 15% of our patient population. The vast majority of our patients are folks who suffer from illnesses that we recover from very quickly, like depression. With treatment, and depression is around the 3rd most common health problem in this area. Is something that's treatable, easy to recover from, and something that most of us will experience at some point in our lives. So the bulk of the people that come through here, children, adults, and families, come through, get the help they need, and go on and continue to live their lives, work, and be productive in our society. That is equally true now as our understanding of mental illness gets better, of people with a more serious and persistent brain disorders such as schizophrenia. So in this part of the building, we work around recovery a lot. We help people get jobs, maintain their jobs, and become productive or stay productive members of our community, because that's the critical aspect of recovery, is not coming to us, but being present and active in our communities is what keeps us all healthy.
Mm-hmm. Mm-hmm. Very good. it's quite a compelling story. The job search, the job acquisition that you do you do it in-house or do you use other services?
We
You
have
that?
a combination.
Okay.
We have a dedicated career center that is funded by Montgomery County that is specific to, it's similar to the OVR's work, the Office of Vocational Rehabilitation, but specific to people with serious mental illness.
Okay.
So we pair up someone who their treatment team believes is job ready with a job coach, employment specialist, and a peer support, and then we help that person not only get a job but maintain a job. We work very actively with area employers to do that. One of the things that we talk about with employers is that at any given time, just statistically, about 25% of your workforce will be suffering from a behavioral health disorder, which makes our people no different. The difference is that we help support that so that the person maintains productive and employed. And our success rate outstrips OVR within the population that we serve. Yeah.
This is just coincidental to the purpose of today, but when we came out of Dave's office, the foundation office, there was a gentleman walking with a cane. And I stopped and we chatted for a little bit and they asked me who I was, where we were going next, and I told him we were coming here. He said, tell him I said hi. I didn't get his name. He was on his way to lunch and he seemed a little rushed, but he had services here, and he says, thank God they were able to help me cure and they helped me get a job. So, I mean, what providence, huh? How about
really,
that? Yeah.
Thank you for sharing that story.
Yeah, it was kind of
one of the innate things about our lives is that the success stories are the ones we typically don't hear again.
Yes, yeah.
Because we want to help people and help people move on with their lives.
Right. Yeah, no, he had a number of health issues and mental issues, but he was so thankful for what you had done for him and found him a job. So
thank you.
It works, all right? Okay. So the rest of the tour,
we're going to show you one of our children's therapy rooms, and I'm going to have one of my directors talk about some of our work with children and families in our community, if that's okay with you.
Yeah, very good, absolutely.
Okay. So this is Jamie Tyson. She's the director of our children's case management and SEMER family stability programs. And I wanted to spend a few minutes having her talk about what we do with children and families, because Creative Health is more commonly known for our adult services, but in my opinion, the heart and soul of what we do is children and family work, especially when we're talking about the borough of Pottstown and the tremendous need in this community. So I was going to hand off to Jamie and let her talk a little bit about that and our family stability program.
Go ahead.
Okay. So one of our newest programs here at Creative Health that I'm really excited about is the SEMER Family Stability Program. It's we were awarded a grant from a private foundation.
Yep.
And the goal of the program is keep the families stably housed so the children's education isn't disruptive. So
and that's an issue in Pottstown, by the way.
It is.
Throughout America.
Yes.
But compared to even Philadelphia, Pottstown has among the highest rate of housing and transiency in the greater Philadelphia region, which is why United Way and SEMER chose this area.
Okay, very good.
Right, but because of the size of it, we really thought with the grant we could really make a big difference. So we're really looking at it more of an economic development kind of program to get these families to put roots in Pottstown. So then, therefore, whether it be buying houses, maybe just help them stabilize their home environment so the kids' education isn't disrupted, which is so important.
Okay. The family, as you mentioned, really does include the children, and I think it's so important that you have a program, be comprehensive, and be able to treat the children. Now, what kind of treatment do you do? What are you looking for? What are their illnesses? They may not have drug abuse, but what are some of the issues that you need to be aware of?
Well, the program itself is we work specifically with the family to help stabilize the household. So if that means that there might be some mental health issues or some drug and alcohol, then we certainly
within
would
other
help
parts
with
of the
that.
family.
Yes, within the family. Yes, but we really work with the families more to kind of stabilize their household, whether that be obtain a job, obtain benefits that will help them be able to do that, make sure the kids are getting to school and that their needs are being met in the home environment so they can get to school. So that's the kind of stuff that we really work on. It's a 6 to 9 month program, so we try to get in there, do what we can, and then get out and make sure they're stable when we're ready to discharge.
How long have you been doing this? How long have you been affiliated with Creative Health?
I've been here for 18 years.
18 years?
Yes.
Wow, okay. In the children's counseling area the whole time, or?
Yeah, in case management. I started in
management.
case management, yep, so all the way through.
Okay. Now, where do you get your clientele? Or is it mostly they say, I need help and I'm going to Creative Health? or are there referrals, or?
A combination. Most of what we do in the community is almost everything that we do is voluntary. So even if the person is referred by someone else, the person or the person's representative has to enroll them in care.
Do you find that they invest more of their personal need then when they come to you, as opposed to
Absolutely.
you having to bring them in? Yeah.
We do a lot of what we call motivational interviewing with people who others recognize a need to change, but maybe not internally themselves yet. That is very common in our opiate work, for example, people with that addiction problems. You've heard of the opioid crisis. So we often start with folks who aren't sure they're ready to change, talking about the readiness for change, the need for change, and get to what we call someone being contemplative, so that someone doesn't have to walk in our doors and say, okay, I'm ready to change. The best case scenarios is someone is aware that something might be better if it changes. So that's what we look for. But referrals come from lots of sources.
And do you find a lot more work today in the area of opioid abuse?
Yes, it's 15 years ago in our drug and alcohol outpatient program, the most common addiction we treated was alcoholism. That has shifted dramatically. It's still probably the most common, but barely so. Opioids have taken off over the past 15 years. I remember when I opened up a clinic in a different community in 2001, we were just beginning to talk about prescription drugs as a problem, and that is really, it's just blossomed. So one of the things that we've done recently in coordination with our area hospital and the Montgomery County Office of Drug and Alcohol Office is we created what we're calling an opioid survivor engagement team, an overdose survivor engagement team. So we're engaging people who are coming into our ERs, or other first responders are finding, who have had an overdose but survived it. And then we're trying to step in and say, you know what, you're not going to survive all of them. Let's try and get this.
Yeah.
Unfortunately, we can't help someone who doesn't survive an overdose, so we're trying to get in there early and send this message that you're not going to survive all your overdoses. And unfortunately, when you're using an illegal, unregulated substance that is incredibly powerful, overdose isn't likely to happen. It is going to happen at some point.
Right, right. And very often they're fatal.
Very often.
And you only get one chance out of perhaps. Yeah. Well, thank you. Jamie, Andy, we appreciate the opportunity to come over and meet with you today and learn more about your services. Hopefully the constituents, as they watch this show, can relate and understand when they have a family situation perhaps that would require that they can pick up the phone. I know your website and your telephone is being broadcast on the screen as we speak, so we'll be able to encourage them to reach out to you. But thank you for the services you provided the community. I know it's a meaningful service, so thank you.
Thank you.
Good to see you. Well, I hope that you have enjoyed the second of two presentations we made on Pottstown Social Services. I think you will be convinced, as I am, that Pottstown is one of those communities that is truly serious about providing quality services to their constituents and to the residents. So thank you very much for joining us. I am State Senator Bob Mensch from the 24th District, and my office contact information will be on the screen shortly. Thank you very much. Enjoy the day.